Great.
Very good.
I'll come in because this is a slim fit shirt and it's a little tighter than I like it to be.
Very good. We'll see you soon.
Great to see you, Kim. All right, for more Wellness Wednesday, here's Tessa.
So many couples eager to expand their family find themselves battling infertility, but each year more and more help is available. The Southeastern Fertility Center in Mount Pleasant maintains it is where life begins and when experience matters. We welcome Dr. Stephanie Singleton this morning.
Thank you.
How does going to a fertility center help someone who's trying to conceive?
I think it's the first step. So patients can come in, they can talk to a physician, determine what might be causing their infertility so that then we can devise a plan to treat their infertility.
Now, of course, when most people, when they get married, sometimes they like to have things planned out. Well, we're going to start trying to have a baby at this point in time in our lives. When should they come see a doctor like yourself when they notice that that's not happening within a timely manner, at least for them?
Right. A lot of that depends upon their age and their history. So as women get older, they need to seek assistance sooner. We find that women beyond age 35 or older should probably come in after about 6 months of trying. If they're younger than 35, depending upon their situation, they can potentially wait 6 months to a year. That's also determined by their history. If they've had significant pelvic surgery, if their partner has had significant surgery, those types of things that might affect their chances to get pregnant, they may need to seek help sooner.
So that would be some of the stuff when you do your testing that you would rule out as to reasons why they're not able to conceive?
Exactly, exactly. Another thing would be if the woman's not having regular periods, then she's probably not releasing eggs regularly and probably needs to seek help sooner.
Okay, now you have what's called a staircase approach to helping the patients that come into your center. Talk to us about that.
Right. Oftentimes patients are afraid to seek help because they've heard that we do aggressive treatments, in vitro fertilization, but that's not the only treatment that we have available. When patients come in, we're going to do an evaluation. We're going to see what pieces and parts we have available to create a baby with, and then we're going to seek the most conservative therapies first. As those therapies work, the patient will get pregnant. If they don't work, we'll walk up the staircase and become more aggressive in our treatment.
Now, what are some of the testings that you do initially if someone comes into your office? So walk us through that process.
Right. So for an initial consultation, they'll come in, we'll talk about their history, we'll do a physical exam, and that includes an ultrasound. So we're going to evaluate the ovaries, we're going to look at the uterus. The real factors that we want to evaluate, we want to look at their egg-making ability, we want to look at the uterine factors, we want to look at the fallopian tubes, and we want to make sure that the partner's producing sperm. So those are the main points of evaluation. Some of those can be done at the very first consultation, others are scheduled according to the woman's period. The semen analysis can actually be done at the very first consultation.
I was going to ask about that.
Absolutely, to save trips for the male partner.
Of course, to rule anything like that out.
Right.
And so are you finding that any particular age group is utilizing your services, or is it just pretty much runs the gamut?
I would say it pretty much runs the gamut. You know, we try to get patients in sooner. Sooner is better for the patient because we know we as women start to have a decrease in our fertility rates beyond age 32, actually, a lot sooner than most of us would think. So we try to get patients or encourage them to come in earlier to seek assistance to do the evaluation so that they at least know if there's an issue at hand. As they approach their later 30s, early 40s, it becomes more and more difficult to achieve pregnancy, even with the technologies. So coming in sooner is much better for their chances.
All right, Dr. Singleton, thank you so much. Some great information this morning.
Thank you for having us.
Thank you for joining us. Well, Wellness Wednesday continues ahead in our next half hour. The American Heart Association joins us for Stroke Awareness and how you can get involved this September.